Hi, I'm Sanjay Majumdar and I'm a hand surgery consultant in the UK. If you're watching this video, it means you're probably going to have a short procedure on your hand under local anesthetic, like a carpal tunnel decompression or trigger finger release. Now, in my experience, there are four things that patients get quite worked up about and get anxious about before the operation. I just want to address these four things for you. First of all is, will I feel the operation once the local anesthetic has gone in? The answer should be no. If the local anesthetic has been administered correctly, your surgeon will test the area before the operation and you should not feel any pain during the operation. You'll feel something going on, but it should not be painful. If it is, you tell your surgeon that they should put some more local anesthetic in. So don't be worried about that. The second is the actual putting in of the local anesthetic. Now, I like to tell my patients the truth. The local anesthetic going in is actually painful. The injection going in is actually a sharp scratch followed by a sting. Now, the sharp scratch is the needle going in, and the sting is when the local anesthetic is actually going on the skin. The sting is like a bee sting, but only for a few seconds, and virtually everybody can manage that if they know it's only going to sting for a few seconds. The next thing is putting up of the tourniquet. Many hand surgeons put a blood pressure cuff up on the arm and inflate it so that there's no blood supply into your hand, and this allows us to be able to do the procedure without blood seeping and we can see all the structures. The blood pressure cuff is quite tight. Anybody who's had a blood pressure done will know that, and most people can tolerate that blood pressure cuff of up to 30 minutes. Most of these procedures, the blood pressure cuff will be up for maximum of 15 minutes. So most people are happy to cope with it very well. Truth be told, I had a hand procedure done, and even though I've done hundreds of carpal tunnel procedures, I found I was fixating on the fact that the blood pressure cuff was up and it was tighter on my arm. If you ignore that, you will cope with it a lot better. So have a chat with someone, or listen to music, or doze off to sleep. Whichever one works for you. It's only going to be there for a short period of time and you'll be able to cope with it just fine. Finally, when they release the blood pressure cuff, you'll find as the blood is rushing back to your fingers, you get all this tingling and pins and needles in your fingers. That's quite normal, but it settles down quite rapidly. And again, if people don't know that they're going to have that, they can get quite anxious, and that's understandable. Now that you know that these things can happen and you're all very short-lived, I hope that you find the procedure a lot less anxiety provoking. Thank you very much.